Nataka tukumpatie nafasi Peter Kipgusgei. Yes, daktari, yes, muuguzi, lakini ni mwananchi na pia ni mwanafunzi ambaye nadhani anahisi kuwa ana jawabu kuhusiana na yale ambayo tunazungumzia hii leo. Simama tafadhali.
Asante sana. Mimi nilikuwa na experience back in 2018. Nilikuwa na mgonjwa ambaye alikuwa ni ndugu yangu na niliweza kumpeleka katika County Referral Hospital moja hapa Kenya, na pale ambapo tulifika kumwona daktari hakuongea mengi. Alisema ya kwamba hangeweza kutusaidia na aliturifa to a private hospital in Nairobi. Sasa tunapata ya kwamba congestion ambayo tuko nayo katika nchi yetu ya Kenya inatokana na the hospitals that we have. They don't have enough facilities to be able to serve the patients at the grassroots level. So unapata ya kwamba most of them are referred to private hospitals or to urban hospitals, and you find that the conditions that they are suffering in can be treated in those hospitals because they have the capacity but they don't have the resources to do that. So I think the government should do something on that, because you find that a county referral hospital is a very big hospital in a county. You find that there are dispensaries whereby people are also referred from the dispensaries to that county referral hospital, and you find that that county referral hospital also doesn't have that enough capacity to serve that patient. And you find that these referrals are the one that causes the jams that you are complaining about. So the government should do something in terms of budgeting and also other resources. Thank you.
Kipgusgei hapo nadhani anazungumzia zaidi kuhusiana na ama naongezea tu kwa kile ambacho Mheshimiwa Sabina Chege alikuwa ametaja hapo. Nataka kumpatia sasa nafasi Sandra kutoka Amnesty International aweze kuuliza swali ambalo pia linafungamana na mada yetu ya hii leo.
Thank you. My name is Sandra Maranya. Mine is an accountability question. There's been talks about patients' rights as well as responsibilities. And indeed, these are provided. We have a document, the National Patients' Rights Charter, that gives all this. So my question is framed as a patient. I am a patient who has experienced ill treatment in a hospital, have either experienced long waiting time, have either experienced poor communication of treatment, where my diagnosis has not been explained to me well in a way that I understand. But I've also experienced detention because I've been unable to pay bills. How do I complain? I want to understand the redress mechanism, how the process goes, but also the response that I get. Will there be accountability? Will I get my issue addressed in the long run?
Trevor?
And Dr. Chibanzi, that is also another question that's coming from one of our viewers. You say, what happened to the dispensaries? Is it the reason referral hospitals are packed? And when he says that the system is broken, what does he mean and how do we fix it?
Okay, so
very briefly.
Yes, briefly. We reinvented the wheel with devolution. We killed the referral system. Dispensaries were very functional. We had even amenity wards. This is the private wards in the public facilities. You had the simple of diseases, or cold cases, being handled at level 2, level 3 facilities. Level 4 and 5 will handle what is required at that level, and level 6 will handle the tertiary cases, the complicated cases. But we killed that system, and so the only way is to now, I think, reinvent the wheel back. So it's like going back and forth. So let us take it back to that level of the primary health care. Let us employ more personnel to work in these low-level health facilities, sort out the patients. Let Kenyatta, let MTRH, let the level 5s handle referrals. Patients are not supposed to walk in with pneumonias into level 4 and 5 facilities and start complaining of 10 hours waiting time because you're overwhelming the doctors who are there. So let the small ailments be sorted out in the lower level facilities. Let the high level facilities handle what is required of them.
All right.
And let us have high qualified personnel even at those lower level facilities. Yeah. Staffing Norms and Standards, Ministry of Health 2014, talks about medical officers at the health center level. These are documents lying in the ministry's shelves. Counties are not implementing this, and so we keep going round in circles.
Okay. Honorable Chege, be that as it may, at what point do the doctors then now also take responsibility? As people who had the Hippocratic oath and people who are supposed to take care of the patients, like the lady from Amnesty International is saying.
I think I'll start from what I said about serving, and one of the doctors said the patients wako na tabia mbaya. I'll also say kuna madaktari pia wako na tabia mbaya. There are some who will not be in the hospital at the time they are supposed to be there, and especially the ones who are serving the public facilities. You know, with private they clock in, but the public facilities, some will come, spend 1 hour, they're supposed to be there for 12 hours or 8 hours, and they disappear. Others will come just to refer the patients to their facilities, their private facilities. And so sometimes we have seen our public facilities not working because they intentionally make them not work so that they can refer patients elsewhere. And I've seen also some of our public facilities, their equipments, you know, just being, you are told they are not functional. How do you work in a facility? You are told an MRI machine has not worked for 2 months, and there are people who are there.
Where was it?
Exactly, and they really don't care, because at that time, then they are referring patients to the places, private places, where they have a deal. I think we need to be sincere with ourselves, and I also want the ministry to take responsibility, and also the county governments, when it comes to budgeting. It was very sad when we looked at the budget for this year, and we recommended, especially with KNH, that is still not doing very well. We recommended quick fixes, and we wanted to redirect a lot of money that was supposed for UHC to go to those, specifically MTRH, Kenyatta National Hospital, Mathari Hospital, and the Spinal Injury Hospital. Yeah. But you find even within the budget committee, they rejected the health committee recommendations, just because maybe the ministry said or the treasury said. But you know, I just want to say.
What do you mean the treasury said?
Exactly.
What's happening there?
They said they want the money to go to UHC, and the question is, what is UHC? UHC, it's about accessibility, affordability, you know.
So even in
quality
the government
of
system,
care.
you're saying that people were sabotaging.
Exactly, and I just want to tell all of them, because we are all responsible, including myself,
but
who
you're
actually
a legislator.
That's what I'm saying.
Person
I am the chair, and we did our recommendation.
In the National Assembly.
Exactly.
You're
and
telling
it
all
is
these
there.
people you can't
It is there
do
on
anything
record. Not
about
that
it.
I can't do anything. It is there on record, and we even did our recommendation.
But
even thought for a
ignored.
second, you know, time when we were doing the amendment. I even stood on the floor of the House to ask the Speaker why our recommendations were rejected. We did a very big report,
And
which
why were
is
they
in the public domain, about Kenyatta National Hospital.
Why were they
Because
rejected?
somebody else feels the money should go elsewhere. But I want to warn them tonight
Where is elsewhere?
that money, which is still under
money going to
UHC,
people's pockets? What are we talking
there are
about?
people who
Let's
would
just
think
talk
buying
the
equipment
truth.
is the best way, because they want to procure, because there's a percentage. But let me
There's a
tell you them
percentage
and warn
kickback
them
or a
that
percentage
is
in
blood
price.
money. So what Kenyans need,
So
it
you're
is
saying that
about
people in the ministry were stealing from Kenya?
not only ministry,
And
it's a
treasury
whole
as well.
chain. They know themselves. As you talked about system being broken, but who breaks the system? It is us. I would say when I was doing the budget, we spent one day up to 1 a.m. going through the budget with the ministry people, and you're asking them, what are you allocating? What is this money meant for? These are billions of money. And we know we have gone to Kenyatta, we have gone to MTRH, we have gone to Mathari, we have gone to the spinal injury. We have a national referral hospital, spinal injury, that only has 32 bed capacity. And so we ask ourselves, we have a facility at Korogosho that is only remaining around 400 million to be complete. Then we can be able to shift our patients there and take care of more people. If you go to Mathari today, you go and see the inmates, how they sleep. They don't even have clothing. Nobody takes care of them. The ministry, the people who are in charge of them, they say they have handed them to the hospital. The hospital say these are not our patients, they are inmates.
Okay.
And you find people who are living like they're not human beings. I think we need to wake up. And we just must be truthful to ourselves and even to Kenyans. So anybody who would take the money that is meant for healthcare and the many deaths we are facing this time in Kenya, it is just right for them to know that that is blood money. It is not right.
Yeah.
We must wake up if it's a doctor. I know they have been pushing for permanent and pensionable, but the whole thing is, could you even work on contract and work well? And then we can renew your contract. It's not only the doctors, even the nurses, even the teachers.
Yeah.
Because we all want to be comfortable. When you become permanent and pensionable, then you relax. And then you can decide, I'll be going to work for 1 day or 1 hour, and then I go to my private clinic. How many of these doctors, and are here and I want to challenge them, will be sent to my home in Kenyona to go and become a doctor there and leave the luxury of Nairobi and agree to go? And that's why you saw when the Cuban doctors came, there was a lot of hula baloo around it. I personally went to Cuba. I found a
Dr.
family
Chibanzi is
doctor.
shaking his head.
I know. I want to tell him the truth.
Yeah.
I found a family doctor who stays in the village with the people. He wakes up in the morning, goes home, home visit, and there's a proper schedule. I think we can do it and we can make it.
Okay.
We have brilliant brains. We have good people who want to serve this nation, but let us just be serious for once.
Chibanzi, I'll give you a right of response, but let's bring in Dr. Catherine here and address that one of the issues that the lady from Amnesty brought up, the issue of detention of patients. Why does that continuously happen? What is the argument from the medical field?
I'll speak about cancer. Cancer care is expensive. As much as we have NHIF subsidizing for the patient, there's a lot that goes on. The cancer medication is expensive. Even in a public facility like Kenyatta National Hospital, we owe suppliers. So that is why a patient has to top up for the bill. And there is what we call a credit mechanism, where if one cannot afford, instead of being detained in hospital, they need to be offered credit. Then they can pay slowly at their pace, or they go and mobilize for funds. But having said that, I think we also, the way we are taking our children to private schools for education, we also need to take our healthcare seriously and save up something. If you're not able to save up, enroll yourself into any form of insurance. NHIF, and if you can spare some extra money, add on another insurance, such that in case of an emergency, we are not selling our property, not digging into our pockets, but we have some insurance standby for the same.
All right, Mashirima, sasa sijui tutafute solution sasa, manake we have run out of time really.
Na Yaha Lotieno yeye alikuwa anauliza tunangojea nini? Maana tunajua kile ambacho tunastahili kufanywa lakini hatukitekelezi. Marvin Ibrahim naye anahisi kuwa kuna swala la kujikinga na magonjwa.
Yes, I'm Marvin Ibrahim from St. Paul's University. And diseases like bilharzia, cholera used to be serious killers in the 90s. And one of the ways in which we tackled these epidemics was through a multidisciplinary approach, whereby we roped in the education sector, as Honchege had alluded. And really, why don't we try this out with cancer? Why don't we give our kids information from lower primary school level on cancer, so that they know what the causative agents are, how to prevent, the kind of lifestyle they should live, so that really we gift them a cancer-free generation, which for us is only a dream. Yes.
Asante sana. Patrick Kivuva katika mtandao wa Twitter anasema we have pneumonia and malaria which is killing the low-income mwananchi. The rich can afford the treatment for such. Let us consider provision of healthcare system for all, not only cancer, because it has taken the rich. Sharon Cheruto naye anasema leaders are busy doing politics while it's people that are dying. Invest in hospitals, invest in cancer curing facilities, invest in what is helpful and tangible. For once, let's be accountable. Responsibility in each and every person. Wacha nimpatie muuguzi mwingine aweze kutueleza kauli yake.
Thank you. Asante sana Mashirima. Ningependa kwanza kutuma rambirambi zangu kwa familia ya Dr. Laboso na familia ya Okoth. My contribution today, and I'm happy Honorable Sabina Chege is here, I want to contribute on both waiting time and cancer in my statement. And I would like to compare private hospitals versus public hospitals. Let us take for an example, I have a breast mass today, a mass in my breast today, and I go to a private hospital. Okay, the doctor will probably order for a mammogram, an ultrasound, and probably a biopsy, isn't it? And probably in 2 hours time I'll have an ultrasound of the breast, in 2 hours time I'll have a mammogram, and probably in a week I'll have results from a biopsy. Dr. Catherine, you can agree with me. This is private hospital. So in 10 days probably you could be going for surgery. Now, keep that in your head. Now if you go to a public hospital, okay, go to Ogembo District Hospital, or Voi or Kitale District Hospital, So today I have a breast mass, okay? And Mashirima is probably the clinical officer available. And I go there, she will send me that probably you need to go to the surgical outpatient clinic. I have 2 weeks. I'll be booked for 2 weeks. In the surgical outpatient clinic, after my 2 weeks of waiting, the private guy was already gone to hospital. After my 2 weeks, I'll get a doctor. And the doctor will order, we need number 1, we need number 2, and we also need a biopsy. If we start with biopsy, there are no pathologists in most government hospitals. So you have to go and get a solution outside. And that's why that good lady said she was given her biopsy to go with it home, so she can take it to a private practitioner. This is quality of health we're giving. Number 2, the mammogram will be booked 3 months later. True or false? It's probably true, isn't it? The queue will be so long, there will be more than 100 people waiting. So by the time you finish seeing that one patient with my breast mass, it's already 6 months. The results are probably invalid. I wish I could hear this, whatever Dr. Catherine will have to say about it. But the truth of the matter, this waiting time, besides being inconvenient for us who have flu, it has serious consequences on these services. Waiting time, turnaround time for an ultrasound, turnaround time for a CT scan or an MRI, turnaround time for surgery if I have a fractured. It is real, and this is affecting the real person. If you go to Mheshimiwa's home today, okay, and you find that person who makes $1 a day, they make 3,000 shillings a month, they will not be able even to afford that biopsy. This is my contribution.
All right. Very interesting there. And final remarks. I'll start with you, Dr. Chibanzi.
Yeah.
Just one line, because you're running out of time here.
Let us stop politicization of healthcare. Let us stop proletarianization of healthcare, where professionals' voices are put on the side and political voices take over. She's talking about Cubans. They pay them 3 times better. Unfortunately, we even lost one of our own. Those doctors, let me say it now, Nashon, those doctors who went to Cuba will not be registered in this country until they come back and undergo 1 extra year, because that program there does not fit in with our program. So financing of healthcare. We can't be talking about a better healthcare system when we are consistently underfunding it. Kenya is 15% of healthcare, of the national budget to healthcare as per the Abuja Declaration. We've never gotten to that level. The highest we've gotten to is 7%. Human resources for health. For UHC, UHC has 4 pillars. 1, a well-trained health workforce, adequate healthcare financing. 3, essential supply of medicine, vaccines, and technologies. And then 4, a robust healthcare information system. So those are the 4 pillars under which you're supposed to concentrate. And if we do concentrate on those, I can assure you, we will get to the level that we want healthcare. But before that, we will not be able to get there. For the human resources, we've prescribed it. Whether we will get it today, 5 years, 10 years from now, a health service commission to manage healthcare human resources for health.
Honorable Shaki, I see you shaking your head. You don't agree with half of what he said?
The thing I want to tell Dr. is that we must embrace change. The way we ran our things or did our training back in the 60s and now, we must now move towards the change and see how we can be able to incorporate all kinds of training. So it's sad just to say when those doctors come, they will not be registered. I think these are laws, and these are laws are made by men, and we can be able to see. And I don't think what he said about the pay is right, and I don't want to go towards how much about the payment and everything else.
Can you confirm that it's not 3 times like you say?
It is not. But
it is not twice
it's
either?
Not.
Is it more than the Kenyan counterparts?
No.
Okay.
Because about the pay, there is what is in the pay and there is accommodation and everything else. So that's a discussion for another day. I don't want to go towards that. But all I want to say is that together we can achieve a lot. Where there is goodwill, I always believe where there is a will, there is a way.
Okay.
And so we need to start from our training. We must change how we have been training our doctors. The issue of the doctors being sent back to KNH to come for training, and then they leave the counties and they're still under our pay, we must look at the way either to send to send some doctors back to the county so that then these ones, when they come to Kenyatta for training, they can be paid at that level. So we must relook at even the curriculum and how we are training our doctors.
Okay.
But all the same, I want to say we have good personnel. We have a very good health sector. And once we work together, it's not about politicization, it's just about all of us working for Kenyans. It's not for myself, not for the doctors or the nurses or anybody else, but let's work for the good of Kenyans.
Okay.
And finally, if you are in the health sector and the resources you are being entrusted by the people of Kenya to take care of, you misuse it, just know one day you'll pay for it.
Why don't you just name and shame them right now? Because you know them.
I rest my case.
Dr. Wamai.
I think all of us need to take responsibility. So from the citizens, and I like what the colleague here was saying, don't walk into Kenyatta National Hospital if you have a cold. Otherwise, the doctors will be so overwhelmed they'll not be able to do their work. Do what we need to do to prevent disease. And I think there's a lot of public awareness. But still, again, that's the second responsibility, the Ministry of Health. Public awareness. So on prevention, so much work needs to be done, because if it's like cancer, there's so much information. If you look at the developed world, there's already their Bureau of Standards are limiting some products from getting into their country. In Kenya, things still go. There are things like paraben in chemicals. We still use them so much. So there's so much that needs to be done that the Ministry of Health, I think, is failing on their job. Our members of parliament here also need to be held to account till we see our politicians also walking into Kenyatta National Hospital for treatment and not just flying out of the hospital. Then even us, we can feel confident. So let's fix the system, and it starts also from the leadership. Start using our healthcare system. And then, of course, the doctors. Even if it's a broken system, let's be ethical. That's all I can say.
All right. Dr. Catherine, as you wind up, just tell us, what do you want the other medical institutions to take into account when they're dealing with cancer? Because I know you're overwhelmed because of the number of referrals that you get to your place. What do you think they should take into consideration to deal with this scourge better?
Yeah, I think healthcare, it's a collective responsibility. All of us are in it. As other healthcare facilities, whether it's private or public, they complement each other, and we should encourage public-private partnership. In any case, whether you go to private or public, you are still a Kenyan being attended to. We also recommend that we reduce on overseas travels for our patients, especially for ailments that can be managed locally, so that we can reinvest in Kenya and build our healthcare facilities, because people are flying out of the country for a cancer that can be managed in Kenya, maybe chemotherapy, radiotherapy, even surgery. They're all available in the country. So if we retain this money in the country and build designated county referral hospitals, we are going to reduce the pressure on Kenyatta Hospital, and our patients will get timely treatment without traveling too far. And we want to make Kenya a center of medical tourism, where we attract the region. We actually stand to attract the region, like East Africa. They can come to Kenya because we one of the best countries in the region. We just need to look at how best we do business.
All right.
Yeah.
All right. Dr. Mwachonda Chibanzi, KMPDU Deputy Secretary General, asante sana for coming in this evening. Honorable Sabina Shege Moranga, Women Rep and Health Committee Chairperson in the National Assembly, asante sana for coming in as well. Dr. Njoki Wamai, Assistant Professor, USIU. And we have also Dr. Catherine Nyongesa, Texas Cancer Center, and also an oncologist. We also had Dr. Halima Adan, Kenya National Union of Nurses Secretary General, Machakos Branch. Asante sana for coming through. And also to all of you, I'm sure this discussion does not end there. There's still so much we haven't talked about. I can assure you we will have a sequel and talk about several other issues in the health sector. Mashirima?
Naam Trevor, na sio wale tu ambao wako hapa ndio wameweza kushiriki. Kuna wale pia wametuma jumbe, kuna wale ambao wametuma kauli zao kupitia mtandao wa Twitter. Nataka tu kumalizia na kauli ambayo imetolewa na baadhi ya watu kwenye mtandao, hususan kwa viongozi wakiwa nawakilishwa hapa na Mheshimiwa Sabina Chege, ni kuwa kwa sasa tunawasikia sana viongozi wakitoa onyo kwa wale ambao wanachukua rasilimali ambayo inastahili kuwasaidia wananchi, hususan katika kuimarisha sekta ya afya. Anasema kuwa kama hamtachukua hatua ya kuwaondoa, basi mtakuwa mnatudanganya mkikaa hapa na kusema kuwa mnawaonya wale ambao wanaiba pesa za wananchi. Naitwa Mashirima Kapombe, usiku mwema.